The Nigerian Association of Resident Doctors on Thursday commenced a 5-day warning strike, which is expected to expire at 8 a.m. on Monday, May the 22nd. Arise Health correspondent Olije Wapara has this report.
The doctors had on April 29 issued a 2-week ultimatum to the government to meet their demands or face industrial action. The demands are immediate massive recruitment of clinical staff in the hospitals and abolishment of the bureaucratic limitations to the immediate replacement of doctors and nurses who leave the system, the immediate infrastructural development in the hospitals with subsequent allocation of at least 15% of the budgetary provisions to health in line with the Abuja Declaration of 2001, immediate payment of the 2023 Medical Residency Training Fund in line with the agreements reached at the stakeholders meeting convened by the Federal Ministry of Health at the conference room of the Minister of State for Health on the 15th of February 2023. The immediate increment in the consolidated medical salary structure to the tune of 200% of the gross salary of doctors in addition to the allowances included in the letter written by NARD to the Minister of Health on the 7th of July 2022. However, the ultimatum was not honored. President of the Nigerian Association of Resident Doctors, Emeka, called on the government to address the issues before the May 29 handover date. He also speaks on the expectation of the doctors from the warning strike and what they will do if their demands are not met.
We have been engaging government on these issues for a long time now, for years actually. And last year, we issued an ultimatum twice on most of these issues, and of course shelved the strike because of appeal. And now, of course, everybody will come and tell you this is not the best time to go on strike. And nobody has been able to tell me the best time to go on strike in the health sector. So I think everybody is in agreement that if you can avoid strike, avoid it. But when you issue like this current ultimatum, there was no attempt by the government whatsoever to meet us. This 5 days warning strike is to alert, is to register our displeasure that government has not acted. We hope that in these 5 days that they will do something, because we are still going to meet again after the 5 days. And if by then both the outgoing government and the incoming one have not shown any visible commitment towards addressing these issues, of course, we leave it in the hands of our National Executive Council. They are the ones that will give the mandate, and I'm aware that all options are on the table. So nobody should blame now if we end up going on indefinite strike by next week.
With just 12 days to the handover date, will the Buhari-led administration respond to the doctors' demand? Only time will tell. Olije Wapara, Arise News.
Well, Dr. Emeka Orji, who you saw speaking in that report and who happens to be the president of the National Association of Resident Doctors, joins us to discuss the industrial strike by the doctors and the federal government's stated determination to employ emergency doctors to replace the striking resident doctors. Good to have you. Thank you so much for joining us here on Newsday.
Thank you.
Great. Now, some reports say that, like I mentioned just a moment ago, that the federal government is negotiating with the National Association of Resident Doctors to end the strike. Seeing your crucial position, can you give us an update on the outcome of those negotiations?
Well, thank you very much for having me. Unfortunately, up till now, there has not been any negotiation. All we have been hearing on the media is that government is negotiating with us, but nobody has called us for any negotiation, except they are negotiating with any other association, but not NAD. It was only just this afternoon, a few minutes ago, that I was informed of a meeting convened by the National Assembly tomorrow. Just this afternoon, I saw the invitation. But outside that, there has not been any negotiation since Monday, 15th of May 2023, that our National Executive Council had an extraordinary session and declared the 5-day strike that commenced yesterday.
Noted. Now, we understand that the federal government is looking to replace striking doctors with ad hoc staff. How did that news of that come across to you when you heard it?
Well, it's strange though, because incidentally, part of the major demands we have in our notice of strike is for the federal government to quickly replace the clinical staff that have left the system. We have been saying that we have massive manpower shortage in our hospitals, and we do not have enough numbers to contain the influx of patients in the in the hospitals across the country, and this has been an issue. So if government that has refused to do that is now waking up to want to employ ad hoc staff, they see it as an option or a way of resolving this issue. I wish them good luck, but just like I have been saying, as long as they do not negotiate in good faith, the crisis in the health sector will continue. Our members are watching. All they have heard so far from the government side are just threats. And indeed, those threats they are issuing, they will be exactly what will escalate the crisis we have already. So I want to call on them again to do the right thing. Our demands are clear, they are specific, they are achievable. And these are things that can be achieved in a matter of days. All they need to do is to show good faith and commitment to achieving those demands and leave all these threats. It's not going to help anybody.
Speaking of not helping anybody, the chairman of the Association of Resident Doctors has described the strike as a total shutdown, saying the action is having a huge negative impact on the health system because resident doctors do make up the largest workforce among doctors in the country. I'm just wondering what resident doctors are doing to ensure that there aren't too many casualties in this case.
Sorry, I'm not sure I understand the question. You said the chairman of Association of...
He's described this
doctors.
action as a total shutdown because resident doctors do make up, they make up the largest workforce among doctors in the country. We have people who have been to hospitals and have not been able to get any treatment or whatever they're seeking at that, at the various places that they go to, or various hospitals that they go to. I'm asking what is being done during this strike to ensure that you don't have too many casualties in terms of people that need medical assistance.
The truth is that the strike is a total shutdown, but I have also said this repeatedly, that patients are already dying in the system because of this manpower shortage. And it has happened over time, for years. And we have been trying to draw the attention of government to this, that there is brain drain, that this brain drain is being caused by poor working condition, poor remuneration, poor infrastructure. We also did tell the government that they should make effort to quickly replace clinical staff that have already left the system, because it takes a minimum of 8 months for any chief medical director to replace anybody that has left the hospital. And government on their own set up a committee last year at the Federal Ministry of Health to find a way of scaling down the time it takes to employ clinical staff. And that committee came up with a recommendation that we make it possible for the CMDs to replace this staff within 3 months. That recommendation was submitted since February this year, and it is just lying down there. Nobody has talked about bringing or backing it up with a circular, because the CMDs cannot work without a circular. Okay, so what we are trying to do is to say that, look, these issues have been lingering for some time, and that's why I keep saying that we are fighting for Nigerian people, because they are the people that patronize these hospitals. They are the people that are dying. They are the people that are witnessing the increasing waiting time. Many of them come to the hospitals, they don't get to see their doctors because they are no longer there. They come to the emergency department where you are supposed to have 10 doctors, you have 1, and people are dying already. Do we rather overlook that, or do we act now? What our members are saying is that we cannot take this any longer. This government that is still in place can still do something even before the May 29th handover. And we are also drawing the attention of the incoming government to know that this challenges exist. And so they can begin now to strategize on how to address them.
Duly noted. Now, speaking of this current administration, shortly before the strike commenced, I believe that you called on the president-elect to bring his experience to bear by resolving this crisis. So you said something a tad different now, but is it fair to say that you're probably losing hope that your grievances will be resolved by this administration?
The truth is that many people that have called us, what they kept telling us was that, oh, this government is about to go, they have packed up, they are not willing to do anything again. In fact, even the body language we've been seeing is more of, oh, why are you people doing this now? The government is over. So if that is the body language of this current government, what do you expect? And in any case, in less than 2 weeks, there will be a new government in place. So whatever this current government does or did not do, the incoming government will still come and inherit it in less than 2 weeks. So I don't see anything wrong in us calling out to the incoming administration to pay attention to what is going on and start early enough to strategize on how to resolve them, because these issues are germane. They have been there for some time, and without addressing them, I can assure you that they're not going to make any progress in the health sector if these issues that we'll be talking about are not squarely addressed.
Noted. Now, in terms of your list of demands, which includes 200% review of CONMES, payment of the 2023 Medical Residency Training Fund, to mention a few, which of those are total non-negotiables, and which might you be a tad flexible with, if any?
See, most of the demands we have made are linked. I did tell you that we have brain drain, and everybody, even the government side, they are in agreement that the most important cause of this brain drain is poor remuneration, poor working condition. And so many of the other demands we've made are in tandem with this awareness and this realization that as long as you do not address the poor remuneration, you will still continue to have brain drain. That was how we came about that request that government should properly review the consolidated medical salary structure. The percentage we have presented on the table is based on facts and figures. If government is disputing it, they should present their own facts, which they use to arrive at whatever percentage we hear they have been offering. The second thing is the issue of 2023 Medical Residency Training Fund. Nigeria needs specialists, and that is why you have people doing residency training. The act governing residency training supports sponsorship. That sponsorship is what we are saying, that up till now, for that of 2023, it has not been paid. And people have gone for update courses, they have gone for exam, they need to be paid. The other issue of the obnoxious bill is a total misdirection of what needs to be done to address the brain drain. I'm talking about the bill by Honorable Ghanaian Johnson. We believe firmly that if that bill is allowed to sail through, it is going to complicate the situation, because people will begin to run away from studying medicine and surgery. And when that happens, you will see lose the numbers that you want to get. There are so many issues in the state tertiary health institutions. Many of these our state governors have totally abandoned the health sector in their states. Our members are calling for the governors that are coming on board and those who are entering their second term in office to invest in the health sector, to try and pay their doctors well, try to pay their training fund, so that they will retain them, because the brain drain we are talking about is both internal and external. You have massive exodus of doctors from the state tertiary health institutions going to the federal, and many of them leaving the country entirely. So essentially, this whole thing cannot be addressed by the federal government alone. So we are calling on the states to also, do what they are supposed to do. We have salary arrears dating back to 2014, 2015, 2016. So these things are germane. And in any case, it is only when you start negotiation that you will hear what government is offering. And if you assess that what they have offered is significant enough, of course, you revert back to your members and seek their input and their further directive. What we are saying is that, as of today, that negotiation has not happened.
Duly noted, Dr. Orji. Now, still on that matter of the brain drain, we do understand that there were reports that the Nigerian government on Monday disclosed that it's not in support, of that bill that's before the National Assembly, and that was communicated by the country's Minister of Labour and Employment. Does that give you any encouragement that at least there's a probability that your list of demands are being considered?
We are happy because that, to us, will be the first time any top-ranking government official has come out in condemnation of that bill. Well, you will realize that condemning that bill is good. We are hoping that the sponsor of the bill and indeed the leadership of the National Assembly will listen to all these condemnations and do the right thing by withdrawing that bill. As of today, we are not aware that the bill has been withdrawn, but we appreciate the condemnation by His Excellency Senator Dr. Chris Ngige. We are happy about it. But let the leadership of the National Assembly and the sponsor of the bill withdraw the bill. As of today, that has not happened.
Well, President of the National Association of Resident Doctors, Dr. Emeka Orji, we'd like to say thank you for joining us on Newsday, and we certainly wish you well.